My name is Hillary Adongo. I'm from Ghana, particularly northern Ghana, but I am based in Bolgatanga and then in Accra. So, growing up as a child, I have been working with my mother, helping her. My mother is a trader, and so I grew up in this environment where I saw how hard women were working, and I just thought that they were working so hard, but they were not getting the yields, the dividends, the benefits were not as commensurate, you know. So at a point after I left the university, or even in the university, I have been thinking about how do I create a space that helps women like my mother to make life worth living for them. And so it's one of the reasons why I founded an organization called Restorative Seed Society. And over the years, we have been involved in a number of activities. I'm sure I'll be sharing some when I start the presentation. So I'm happy to be here. I have a background in earth science, which is what I studied for my first degree. I am from the University for Development Studies. I'm currently at the University of Ghana, working on my thesis now on environmental science. So I'm doing an MPhil in environmental science. So that's a bit about me, I should say. Thank you very much once again this afternoon, and for the opportunity to share some thoughts with you, particularly based on our experiences at Restorative Seed Society. So this afternoon, I would talk to you a bit about Restorative Seed Society. I already told you just a short story that resulted in us starting the organization. I would also talk about the issue of gender roles, which sometimes is referred to as social constructs, and then how that is affecting or emerging health issues that result from that. And then we would conclude by looking at the implications for development partnerships. So let me say that I have a number of pictures I would just describe to tell the story of Restorative Seed Society. So I hope that you enjoy my first few slides, which are pictures. Okay. So Restorative Seed Society is based in Bolgatanga. Bolgatanga is in the Upper East region of Ghana. And in 2011, it was incorporated as an NGO. But it actually started as a club for youth before 2011. And our aim is to help make life better for the poor in society. So on your left, or yes, on my left, the left side is our main office. That's the door to our main office in Bolgatanga. Then we have a literacy school, the Bolgatanga Literacy School, on your right. So this is how the school there looks like. So Restorative Seed Society does a number of things. On your left, you find me talking to, these are university graduates And usually every year I have the opportunity to talk to them on entrepreneurship and personal development. And so this is one of the sessions in Bongo. Bongo is one of the towns in the Upper East region. Then on the right, you see that I was given a citation by the National Service Personnel Association of Ghana for my continuous support to the association. So we have a partnership with an institution called the Design and Technology Institute. And these young men that you see here in uniform are on scholarship, which we helped them to secure. We are actually the liaison office for DTI in the Upper East region. So we help to recruit students to the school. And all these young people are in Accra learning entrepreneurship, fabrication, and technical subjects. So these are some community meetings. On your left, this was a forum that we organized on child marriages in a community called Shiga. And then on my right, this was a meeting prior to our formation or starting of a literacy school project in the Nabdam district, which Impact Direct supported us to initiate. Then we have also been involved in communication and leadership trainings of community leaders. So on the left, you find me with one of my mentors. He's called Edward Powell. He's Dutch. So Edward was one of the trainers that used to come through a foundation called Libre Foundation, also based in the Netherlands. And then these are some participants on your right after one of our trainings. These are also pictures of the same. And let me just mention that communication and leadership are central to helping community leaders develop the communities in the very way that we all look up to. And so Restorative Seed Society was excited to be part of Libre Foundation's work in Ghana. And for a number of years, my office served as the rep for Ghana. And I was the project coordinator organizing these trainings in Ghana. So we also have links with other organizations. This was a meeting in Sunyani on your left with other members of the Coalition of NGOs in Health. And then on my right, somewhere in Accra, the State of the World Population Report was being launched. And then I was invited. So we have also been engaged in a number of trainings, including providing digital skills training for small businesses. On your left, you have some group from Navrongo or the Kasna Nankana district. And then on your right, you have a group from the Bogatanga municipality. So we are currently doing a project called the Cultural Music Project. And then as you can see, we are supporting cultural musicians to develop their talents. So these are some pictures of that. Yes, I also engage the media on a number of things, particularly on issues of advocacy. So we use the radio and the media quite a lot. So these are also pictures of our literacy school sessions. So we have one on the left, that is Bogatanga. And then on the right is Nabdam. There's a community called Congo Dabori. That's where we are. Before COVID, or when COVID struck, we also made a donation. And that's the donation that we made to an orphanage called the Next Generation Home Orphanage. Okay, so I will continue to the main topic, but let me mention that if you have a question in the course of my presentation, I'm sure you can draw my attention, and then we can be able to have the discussion. Are we all on the same page? Can I continue? Okay. Okay. All right. Thank you. So, in the course of our work, we face a number of challenges. One of the key challenges that we keep facing has to do with the issue of social constructs, or what we refer to in general terms as gender or gender roles. And we just want to examine how that affects us in practical terms, some of the engagements that we have had and the challenges. But let me mention that for the purpose of this presentation, gender roles, we are talking about what society thinks about you for being a woman or for being a man. I know that gender has a very broad definition to include other areas, sexual orientations and disability and all that. But this presentation is limited to just talking about males and females. So we may not be looking at other forms in this presentation. So the communities that we work in are male dominated, which we usually refer to as patriarchal. Many of the things, community leaders are men. In every area, when you go and you want a leader, it's a man, usually. So that's a patriarchal society. So females in these kinds of communities are affected because they are mostly not the leaders in many instances. So, but the issue is that why should we bother about gender roles? Should we bother at all by gender roles? After the definition, do you think that we should bother about gender roles? Our work shows that we should be bothered. The reason is that gender roles have affected the well-being of many people in our societies, particularly women, because in the societies where we work, or in the communities where we work, because it is male-dominated, mostly the roles or the issues of gender tilt in the favor of men. and not in the favor of women. So it gives a lot of cause for alarm. And so it is important that we are worried. So for example, if we say that women are weak, what really is the problem about it? Just think about it. As we go on, we would see the implications, which is the reason why the issue of gender roles must be a bother to all of us. So begin to think about it, that if somebody refers to you as being strong or as being weak because of your gender, how does that impact you? So as we look at that and as we go on with the examples, I'm sure it will be clear to us how that affects us. But there is something that it's a bit worrying, and it is that gender roles are ingrained in our culture as a people, and sometimes in our religion. So it becomes really difficult to be able to deconstruct them. And that is one key challenge. And because it is difficult to deconstruct because it is part of our culture, it is important that we learn how to navigate around these issues. And I'm sure that by the time I'll be making my conclusions, we would realize some of the things that we can be able to do that can help us to deal with the issue of gender roles. So I'm going to give a number of examples that we have encountered in the field and how that has affected the health of communities, affected community health projects, and particularly affected the health of women. So, for example, we were in a community taking data of the households, and because we were profiling them for a health project. And we got to a home, and then apparently everyone had gone out, but there was a woman with her kids who would not talk to us because there was no male available, and she would not talk because she is not the head of the home. You know, so it was worrying because we could not get the kind of information that we needed from her, and she would not talk, and we had to pass her house. So these are some of the health issues that emerge from the issue of gender roles. Someone is head, and once the person is there, the woman will refuse to talk or provide responses to social workers if you come in for any engagement. So the other thing has to do with, we are doing something on immunization with support from the Ghana Coalition of NGOs in Health. We are doing something on immunization. Now, one of the things that we have noticed over the years with our work has to do with having to ensure that the days for immunization also does not coincide with market days. so that women are not in the markets, but are at home, so that they can bring the kids for immunization. It has been common to see where you go, and then because the women are not at home, the children, no one brings them for vaccination or immunization. And so sometimes what we have to do is to make sure that you are fixing the day for immunization on a day that is not a market day, or to be sure that there is no funeral which takes the women out of the community, so that you can have a day that will work. Otherwise, the men will not come because they don't see it as they would not bring the children for vaccination because they don't see it as their role, but that of the women. So I think another thing which is a lot more broader across Ghana and not necessarily in our communities where we work has to do with the issue of experts, gynecological experts. Gynecologists are the people who take care of pregnant women, the experts, the doctors who take care of pregnant women. But many of them who are in the hospitals are men. So for a woman to engage with a man on their reproductive health, it's a lot more challenging than engaging their fellow woman. But how did this come about? Growing up in our communities, we say that males are for the sciences and females are for the humanities or the social sciences. So because we keep putting some of these things in their minds, oh, mathematics is hard, science is hard, so the women go and study something else. The result after 20 years or so is that you don't have many of the women in roles that they can help other women. And this is just one of those general examples that I would like us to see, which we have encountered. Now, I'm sure that you probably have read or seen somewhere about the place of a girl child being the kitchen. And I think that this is one of the big issues that we have faced, especially dealing with issues of child marriage. Many times, the girls would not be taken to school, and so they are at home, and the more they are around, they are susceptible to abuse. Because they are not in school, the parents easily give them out in marriage. So these are some of the things that we have seen and we really see happening quite commonly in our communities. And maybe suffice it, yes. Okay, so suffice it to say that one of the challenges that we have encountered lately in our communities has been the rise in child marriages. And the child marriages, we have encountered them particularly because many of the girls that fell victim were given out to men so that the parents can be able to earn something to take care of the younger siblings. So sometimes there are reports in schools where a girl stops going to school for some time, and then a teacher visits only to be told that the man has 5 children, and so he cannot take care of all of them. So they have given the girl out in marriage so that they can be able to get some income to take care of the other siblings. So,
can I ask you something? Can you hear me from here?
has anybody got a question to ask?
Like, can you mention how old are these girls when they are going to marry?
Can I go on?
Can you hear me?
Yes.
How old are these girls when they are going to marry?
Okay. Yeah. So, less than 16 years. Less than 16 years. In actual fact, in Ghana, of course, I'm sure in many places, 18 years, you're an adult. But in Ghana also, our laws say that you can consent to sex at 16. So it's quite a bit of a challenge that we have always been discussing even at our level, trying to understand, because there is an ambiguity that sometimes when a child is given out in marriage, for instance, and then you say that, okay, this child is 16 years, the child says that, yes, she consented. And usually, one of the key things that brings about child marriages is pregnancies. So once the child becomes pregnant and says that, yes, she consented to the sex, it really becomes difficult to trace that. And that is in our laws, that a child at 16 can consent to sex, but cannot marry. So yes, those are the ages.
And you were also saying that if a girl marries, then the parents will they earn something. Like, can you explain that? What would they earn and who's giving it?
Yeah, so if depending on the culture of the people, when a girl is getting married, sometimes you can get 2 or 3 cows as dowry. I'm sure you know what dowry is. The pay, I don't want to call it payment, but it's the offer for the marriage. So that is something that is given out. In other places, they can provide money if they don't have that, so that you can be able to use that to buy. They also provide food. So it depends on where, but there is something given out to the family of the woman. Yeah.
You have some questions so far? Yeah, I wonder how you discuss this topics with families. For example, when you see a family where a girl is getting married so young, like how do you talk with parents, or how do you create awareness in the community?
Okay, so I don't know if I got you correctly, but what I heard is that how do we talk to the families, or how do we engage the families if a girl is giving out in marriage? Is that correct? Okay. Yeah, so sometimes it's a bit complicated, especially when you cannot determine the age of a child because the child was not born in a hospital. So this is a child, but you cannot determine that because they don't have a birth set, for instance. So some of these things can sometimes be impediments. So when you approach the families, then it becomes difficult for you to prove that it's a child involved. But we have communities are getting enlightened as we go on. There are volunteers in the various communities. There are community leaders who are beginning to realize how detrimental this is to children. And so in many communities, if a child is given out in marriage by parents and it is not hidden, someone will report to an NGO working in the community or to the community leaders. You can go there as an NGO and then you can be able to talk with the parents. But the law is also on your as an NGO person, as a social worker, the law is on your side sometimes. But the challenge that we also have is that the enforcement of the law is weak. The enforcement of the law is weak. Many of the institutions that are supposed to enforce the law are so weak that if you go to them, for instance, and report a case, it becomes your cost to take them to the community. It becomes your cost. For instance, issues that will involve bringing in the police. You may have to pay the cost of transport for the police to go into the community to make any arrests if there are challenges and all that, if the families are resistant. So sometimes these are some of the challenges that we have. Yes, you may hear, but you may not be able to pursue the matter very far because the institutions that are supposed to help you fight are not resourced enough to be able to help you. I mean, I have heard of a number of cases of rape, for instance. But at a point, it gets draining for you as a social worker involved in this because you end up spending your personal resources to address the matter because you can go to the police and then they tell you that you have to pay for the medical bills for the test. It's not free. You have to pay for their transport to the communities and back, and it can take you as long as time allows. So these are some of the challenges that sometimes we encounter. Yeah. Does that answer your question, or you still have?
Yes, thank you. I have another question, if that's okay.
Yeah, and Hillary, we have another question, and shall we get to the solutions then after?
Okay, I don't mind if it's in line. I could just finish, and then maybe other questions can come.
Okay, please.
How would you teach or create awareness in communities, for example, teach parents to raise their children, both boys and girls, equally?
Okay, so I would give you an example of something I did a few years ago. I was facilitating a session in Bongo, and it was on child sexual exploitation. So usually, one of the things that hinders parents from engaging their children is we consider issues of sex as sacred. So usually these are not topics that are spoken or addressed openly. So parents usually don't want to talk to their children on some of these matters. So the strategy that I adopted was that the workshop that I was to do in the community, I invited girls and their parents. So the girls and their parents came together for the workshop. And we had a discussion and asked the two of them the pair, to sit and have a discussion around the issues, so that we can break the kind of myth that surrounds some of these issues. So we have a number of ways that we do our sensitization, but sometimes, depending on these barriers, we try to use other innovative ways, like what I did by bringing parents and children to one meeting, so that they and their parents, we can have discussions that will help them break the challenges that keep them from talking to their parents or raising their children in a more responsible manner. But the common ways, we go to communities, we invite everybody, we invite the chiefs, we invite the community leaders, and then we talk to them about the implications of some of these things. And then we invite sometimes the law enforcement agencies or some of the social workers. And one of the pictures I showed, just a moment. This picture on the left was one of such meetings that we had in a community called Shiga. And we brought the community leaders and women and the men together to discuss these issues. Can I go on? Does that respond to you?
Yes, thank you.
Yes, please continue. Maybe we'll have some more questions later.
Okay. All right. So there are also a few encounters that we have had. For instance, in some of our hospitals, usually it takes a long time to get served when you are in the hospital. So you are sick, you go to the hospital, and then you can go to the hospital in the morning, sometimes, maybe let me say 9 a.m., and then maybe you see a doctor around 3 p.m., particularly in what we refer to as the district hospitals. So, because there are a lot of people, but these hospitals that are located in the rural areas, for that matter, a man is most likely to be called from the queue to come and be served than a woman. So yes, you may arrive before, but maybe a man arrives and then they say that, okay, so they will serve the man and then he will go, so that you, the women, can also take your turn. The other thing that we have encountered in our work has to do with the issue of the health insurance. Sometimes a number of the reproductive health issues that women encounter are not covered by the health insurances that we have. So it tends to suggest sometimes that the system shows some biases, because some of the, or most of the things that affect women's health have to do with issues of their reproduction. So if many of these things are not also covered by the health insurance, then somehow it appears that the women have not been fairly treated, or the health care system shows some biases towards them. I belong to a group, and many of our groups, we advocate for this and we have been doing it for many years, that sanitary pads in Ghana for girls is categorized as a luxury product, and they are heavily taxed, so it gets expensive for the rural girl because they cannot afford it. They have issues of food to deal with, and they cannot spend 20 cedis or 30 cedis to buy a pack of sanitary pads. They can't afford that. So that's one of the big challenges that we also see. And it's surprising that for a long time, advocacy has been going on, but it has not changed. But anyway, let me not say that it's surprising, because many of the people who have to take the decisions are men. So somehow that is affecting the livelihood or the well-being of girls, particularly those in the rural areas. Because the people who will take those hard decisions and change some of these things don't go through what they go through, or don't even understand what they go through. So that's one of the other things that we encounter daily in Ghana. Let me just say that there have been I have been part of a number of initiatives where we help to produce reusable pads, so that many of the girls in the villages can be able to get sanitary pads that they can use and then reuse them after cleaning them and all that, so that it saves them from the burden of having to be paying every time to buy new ones. Okay, so are there any questions anyway? Otherwise, I will just continue and finish with what we are doing. So one of the things that we believe in is indigenous knowledge. We believe that we cannot develop a community with knowledge from outside. The community has survived for years. It has its own systems in place, and for years it has thrived. How can we take advantage of the community's resilience to be able to help the community thrive? So, for instance, we continue to engage communities so that we will understand them better. We engage farmers, we engage startups and businesses, so that the more we understand them, the more we understand how these communities operate and work, the more we understand the challenges that they have, then we can be able to develop project blueprints, that can specifically address these issues in these communities. So in our projects, we have community engagements as one of the things that we do, because it allows us to continuously learn from these people, to continuously identify the challenges that they go through, so that we can be able to implement projects or improve the projects that we are implementing, so that they can deliver the value that these communities really need. And then also, one key thing has also got to do with our intent to always try to use our projects to help the communities or the target group to form associations, because that is one of the things that we see as the way forward. That if the NGO will not be in your community forever, but if a group of women, a group of farmers, a group of small business owners come together, they can be able to stand and address some of the challenges that they face. But usually how to come together is one of those challenges. So for instance, in our current project with the cultural musicians, one of the things that we are doing is that we use our workshop spaces to also help them to have their own meetings. So as part of the initial preparations to help them form the associations, we organize a workshop or we organize a training for them. But we would allow them some time so that they can be able to come together and fraternize. They can be able to use that opportunity as their rallying point to be able to discuss things and then be able to form the kind of association that they would need to push their agenda forward. So what are the implications for development cooperation, for instance? So we must always incorporate local knowledge in the planning of our projects. If we want to plan any project, we want to implement any project in any community, we must plan with the community. We must hear from the community. We must engage the community so that we can be able to get their perspective and provide trainings that will help. So what that means is that, and I am happy to share that what Impact Direct started about 3 years ago with this kind of partnership that we have, where Impact Direct does not just say that, okay, so this is what we want to do. We give you money, do it, and bring us a report. But they engage the organizations that are on the ground, and then we come on with the ideas that we have also picked from the communities. And that is how our projects are birthed. And that is the sure way to the next phase of development cooperation. If our aim is actually to ensure that our communities develop and move from where they are to other levels, then this will be the way to go. So development corporations must take a new turn, to engage local experts. And that is exactly what Impact Direct is piloting, I should say. And I think that we are making some progress in the last few years. The other thing that particularly will be interesting for students will be to try to create projects out of their research work. It is also the other way around. You can research in the communities before you implement the project. Do an independent research. And I think that particularly here in Ghana, many of the researches that we do are usually just for schoolwork, and we don't use it. But if we actually do our projects well, we would love to try the ideas and to see how they work. So I think that that is one of the things that as social work students, we would like to try. If we are investigating an idea, if we are investigating an approach to development, and then we come out with our findings, can we try to test it? Because we have consulted the people and come up with those ideas so that we will know if it works, so that we can be able to have we can improve the ways of working so that we can be able to bring or get the kind of results that we want in our communities. And then lastly, yes, as we implement our projects, we need to continuously examine what we are doing, continuously engage so that we can be able to straighten up the crooked paths in the implementation of our projects. Okay, so thank you very much. In Frafra, Mposia is thank you. So you may reach us by email, as you see. So thank you very much, and I'm open for more questions if there are any.